everybody, welcome back. Last lecture, we talked about advocacy and what it was. This lecture, we're going to talk a little bit more about how it works and what that might look like for everybody. So again, I'm Beth Liston. Thanks for joining. I think this is important, and I'm really glad that everyone's here. So when we talk about legislative advocacy, or advocacy in general, there's a number of different things that we want to consider. Let's go ahead and share screen so everyone can see my slides. How does this all work? Hopefully you remember this graphic from last lecture, right? We want to plan and set those policy goals and research and issues. And everyone was able to go to the APHA website and look at some of the policies, really get a sense of what those issues might be. But the meat of it really is doing that organizing, building support, and then advocating and lobbying. And so we're going to talk more specifically about these two components today. Your goal, right, is your policy change. And to get there, there's a couple of corners to the efforts. One is organizing. We've talked a little bit about that. We're going to talk a little bit more today. Two is that media advocacy, and ultimately we want both of those to lead to that policy change through lobbying that gives us our public health goal. So organizing. And organizing sounds relatively simple, and it is, but done effectively, it can really add so much to your efforts. You don't want to reinvent the wheel. You don't want to create a new organization or group that's looking at an issue when 10 others exist, right? The goal is to bring all of those efforts together so that you can make those concrete changes. So you need to ask yourself when you're looking at a policy, who cares? Who cares about this policy? And not flippantly, but really, who actually cares? You have to identify the stakeholders, and you can do that, through mental exercises. You have to do some searching too. Think about who your issue impacts. So, for example, gun safety. Lots of people in public health in the last couple of years have been really looking at gun safety and how can we address excess death related to the lack of that. There are many different advocacy groups that are engaged. So if you start spending a little bit of time looking into it, you'll see things like Moms Demand Action, which is, women coming together that feel strongly about enacting common sense gun reform. Everytown USA and Sandy Hook, these are things that grew out of some of the tragedies we saw in Connecticut through the shooting at Sandy Hook. There's a coalition to stop gun violence. There's a lot of organizations, if you spend a little bit of time, that might feel like enacting changes to gun legislation is really important. But it's really also important not to overlook those who might be opposed to some of your suggestions, right? So I put on here organizations that are more typically pro-gun and resistant to changes. And that includes, in this state, Buckeye Firearms or the National Rifle Association. Because you really want to take a look at both who's going to be for your issue and who might be against. And then truthfully, if you can reach them and connect with them and find something that they'll support, you have a much stronger chance of getting a change enacted. But don't stop there. You don't want to stop at just the organizations that have come together about your issue. You really want to think about who else actually cares about the issue. So in gun safety, the American Association of Pediatrics, they've really been spending a lot of time and energy trying to look at the impact of guns on kids, on accidental shootings, on gun safety legislation that might make a difference both in those accidental shootings and then suicides. Because as you may be aware, more than half of the gun deaths in this country actually come from suicides. So when you look at suicides plus accidental deaths, and you're looking at the youth, there's a lot of kid advocacy organizations that really care about this type of reform and or legislation. Stand Up for Racial Justice, or SURGE, is another group, right? Looking at the disproportionate impact on minority communities and how we can address gun safety in that manner. So that's a group that you might look to. And then truthfully, lots of parents in schools are concerned about gun safety. And students, we know there's been a huge student movement after the Parkland shooting in Florida, where students really got engaged and wanted to speak out. So I invite you, as you look at your issue, both to look at those that are organizationally pro any reform that you want to enact, those that might be resistant, and reach out and speak with them and ask why, and see where you might be able to come to a consensus. And then also think broadly. Who else cares about the things that you're working on and why? And be creative with that, because the more that you can engage that broader based coalition, the more likely you are to impact the actual policy. Then I put on here clean water as well, because we've mentioned that as one of the examples and that the APHA had some clear guidelines on. And some of the organizations that you might find that work in this space, again, I don't have on here, but you have to think who might be resistant to any policy that you're putting forth, right? Are there farming impacts in agriculture that you need to reach out to the Farm Bureau or to farmers to try to understand that approach, right? There's a lot of different organizations that you need to think about when you're looking at a broad-based policy change and coalition building, right? And again, think about who else cares. Parents, schools, children, healthcare groups. What other organizations could you engage for your policy? And so as we look at our triangle, all the things that go into those steps to try to reach your goal, we're talking about organizing and doing that stakeholder analysis, which is going to be a next step for you after you've identified your policy. I'm going to touch briefly on media advocacy, and then we'll go into that lobbying piece, especially at the state level, where a lot of the health policy really comes together. So media advocacy, this is really another way to say, how can we build a bigger group, right? We can identify organizations, but what about the people that aren't part of organizations? What about the people who haven't thought specifically about the issue? How can we reach them, and how do we message that? And I'm going to put this into a couple of buckets. One, in terms of media, is social media. You know, that's obviously a growing area where people are engaged. There's lots of different media components. There's lots of different platforms, but it's relatively free. It reaches a lot of people, and you have the opportunity to spread your message and spread support or build support for your policy that way. Earned media. It's kind of a funny phrase, and I'll tell you, it took me a little bit to realize that that meant coverage from groups that you've earned because you have created a buzz or created news. So if you've done a big event in support of your policy and the TV cameras come and a newspaper article is written about it, that's earned media. You've done something that earned attention, and that allows you to get your message more broadly. So things that you do that bring that attention can help with your advocacy. And then finally, paid media, right? You can buy ads, you can create commercials, you can reach out to lots of different groups if you have enough funds. Obviously, often in public health advocacy and policy, there's not huge groups of large donors behind you, but in any nonprofit or any public health or any advocacy venture, you just think about what media can you purchase, can you build support by doing advertising. Okay, so let's circle back around to that lobbying, because that's kind of the point, that the top of that pyramid that allows that change in actual policy. All of the other things really still build your issue, right? Even if you don't change a policy and you build awareness, that can have impacts on behavior and ultimately health outcomes. But here we're focusing on the legislative advocacy and lobbying, which, in some ways has a funny connotation. That if you say you're lobbying something, it sounds somewhat like you're a special interest, and maybe it's not as pure as you'd like it to be. But really, in this context, you're talking about how do you get to the decision makers so that they understand all of the science and data that you have, behind those public health policies and concepts. Right? People know that this is bad for their health, or people know that this policy is bad for everyone's health, and get to the people that can actually make changes. So in legislative advocacy, or just in any type of advocacy where you're looking at getting to those decision makers and lobbying, the most impactful thing you can do is connecting with people about your issue. And the more authentic those connections are, the better. So if you already have relationships with legislators, with city council members, with congresspeople, with anyone that really changes policy, that's the most effective thing, because people learn to trust you. If you have those relationships and you build trust, people are more likely to listen to what you have to say. But many of us, or many people, are really trying to build a voice for a specific issue and don't necessarily spend a ton of time making those relationships. At which point, obviously, you do your best to build authentic communication. So I put some examples on this slide where you're talking about most effective versus least effective. Right? The most effective way to get your message across is actually meeting with the person who makes the decisions, so that you can share your issue and share why it matters from a data perspective, but also a personal perspective, what it means for people and people's health. And make sure that they really hear you. Again, you're building trust, you're giving a concrete, specific message about the things that you know and have researched, and also that you have perspective on why it really matters. Sometimes you can't meet with the actual legislator. Meeting with their office allows you to give your story and your connection to someone who has direct contact with the legislator. So, in some offices you'll have a number of different people, and some you'll just have one. But if you make that personal connection and can really explain why this matters, that's always going to be better than an indirect method. If you can't meet with your representative, you can give them a call. We'll talk about how you set these up in later in this lecture and then in upcoming lectures. You can always email. I know that it's a little less personal, it's a little harder to communicate, but obviously convenient in terms of the time that you're able to spend and think about, and obviously you can do it on off hours. It doesn't have to be open. And if you can't meet with your legislator and are a little uncomfortable on the phone, email is still a great way to share the story and share your passion. Tweeting, social media, a little less effective. Most representatives don't necessarily have their own or aren't managing all of their own accounts. And if they are, it's still hard to get that real connection that allows trust from someone that may be distantly giving advice or thoughts. Social media isn't the best medium for in-depth policy discussions or for places for people to ask questions. But again, it is a communication method that is available to people. And then I mentioned this was direct. You can indirectly communicate. We talked about media. We talked about mobilizing, organizing. The more people that are spreading your message, either through building this large group or building sort of public opinion, the better. And that leads to some change down the road. So where should you target? Right? There's a lot of different layers in government. And it's sometimes hard to figure it out, right? I have certainly had people that are passionately telling me about the traffic patterns at a streetlight, and I'm a state level legislator. I really don't address some of the city planning issues in terms of how traffic patterns go, or how those streetlights might work. Similarly, I've had people come and tell me that they really want me to vote for this federal bill. So right now we're talking about the HEROES Act, which is one of the pieces of legislation designed to address coronavirus. And people still might email me or tell me that they really want me to vote for it. Or occasionally I've gotten emails about legislation in other states, and I have no ability to impact those. So even if I really wanted to, or I supported their issue, I can't fix it. And I can certainly lead people to the correct person, but it's really helpful if you think beforehand what the appropriate level of government is, where you want to target your advocacy. So for example, city government, I mentioned, traffic patterns. So from a public health perspective, if you were looking at a community that you thought would benefit from, increased mobility or even decreased emissions, right? Things like walkability and city planning really matters. When you're looking about zoning, where you can have commercial buildings. Complete streets is a concept that allows cities to think about how they could have everything connected, either by public transport or walking or bikes, different ways where people could really transport themselves and get to where they need to be without actually having to use a car or an individual motorized transport. And same thing with city planning. If you think about how our trails and sidewalks, there's a lot of public health components to what cities can do when you're talking locally. And I mentioned the federal government, right? If you're looking at big changes to our healthcare system and what that might look like, much of that has impact at the federal level. And so you'd really be wanting to target people in Congress or your senators and their offices for those sort of advocacy issues. But we're going to hone in on the state government because I think many people don't know how many things the state government does, especially, I guess broadly as well as related to health. So a lot of the things that people really care about in their lives or even in advocacy happen at the state level. So I have on here a list of things. School funding, people care a lot about education, and clearly there are health impacts to education and opportunity. And we know that, education outcomes impact health outcomes, and, even the health insurance status of a parent will impact the educational outcomes of a child and increase their health outcomes. There's a lot of components there. Medicaid issues, when you talk about things like making sure people have Medicaid expansion or have access to Medicaid. When you talk about any restrictions that might be placed on Medicaid and what it'll cover and what it'll fund, that's done at the state level. I mentioned gun laws, that's all, well, it's not all, but many of the laws that we talk about are at the state. We've talked abortion laws, lots of people get engaged in reproductive health. This is state level issues, environmental regulations, and different health investments and social service investments. So last lecture, we discussed Minnesota and those investments in affordable housing. That happens at the state. Can happen federally and can also happen locally, but a lot of it really is at the state. So I just wanted to put this up so people have that sense of where state money goes to and the types of things it supports. The large majority are Medicaid and education programming, right? Whether it's Medicaid and it's primary and secondary education or higher education, that's really this whole component. And that's the state spending. And state spending is a little funny because it also includes some federal grants. And so the numbers are a little bit hard sometimes to reconcile. But as a proportion, right, mostly Medicaid, secondary education, higher ed, some of that justice and public protection. This is all of the prison system and we'll pay for that. And then here within the others, right? There's some debt service, but there's a lot of these health and human services. So investments in programs that impact health. Now, this information you can get. You can get it at any time, and I'm just going to sort of go through it. If you, in Ohio, there's something called the Legislative Services Commission. So if you say LSC, Legislative Services Commission, Ohio, you can go here and pull this up at any point, right? And actually go to Budget Central, and they'll give you all of the information on the operating budget, where the money comes from, where the money goes, whether you're over budget, whether you're under budget. It's actually a really great resource that probably people don't know about, but it's just this LSC, Legislative Services Commission, which is a nonpartisan group that provides information on all of the different expenditures, and basically it provides all of the nonpartisan information and research. And I'll talk a little bit about that when we really dive into this system in Ohio. Where does the money come from? Mostly non-auto sales and use, so sales tax. And then obviously there's also some sales tax on auto, and that's a component as well. Sales tax and then income tax. There's a fair bit from cigarette tax and alcoholic beverages, and then liquor gallonages. So, I think many people have probably thought a little bit about, during their public health exposure, about cigarette taxes and how we address tobacco as well as alcohol use and how we address that from a public health perspective. So I just want you to see where that stands in our state government. So in addition to which level, you do have to think a little bit about which branch. We're focusing on the legislative branch. The legislative branch makes laws. But clearly the executive branch is, the governor in the state, the president, the mayor, if you have a strong mayor and a city council. And they have a fair bit of power in terms of the agencies. They run all of the agencies, so Health and Human Services. Or in our state, I think the one that's been really the focus right now is the Ohio Department of Health. So all of the advice and or policies that are being implemented related to coronavirus right now are implemented at the executive level through the Ohio Department of Health. So, often I'm given information as a legislator by people about their feelings on the executive branch. I obviously, as a legislator, have some checks and balances. So we have the ability to impact what the executive branch does, but some of those decisions are really made through the agencies. The legislative branch makes laws, and we can shine a light and we can advocate at the executive level. And then we can change the law, but the law takes a little while to change. It's not quite as quick as changing an agency policy. And we'll talk about that next lecture on exactly how that works and what it looks like for the law to change. But I think distinguishing what level you want to get engaged is important. And obviously then there's the judicial branch, a little more difficult to advocate because they really work hard at being impartial and not, looking at legal precedent and interpretation rather than public opinion. But being aware of which branch the policy that you're excited about or, concerned about is being implemented is important. So as we move forward, we're going to talk about that legislative advocacy, specifically within the Ohio General Assembly. Now, this is Ohio. Every state is a little different, and give some of the examples of differences moving forward. But the General Assembly, think about it as the Ohio Congress, right? We're the legislative branch in this state, and every state has a different format, a different structure. Unlike the federal branch, where every state has 2 senators and Congress people that are based on the population. So in Ohio, we have 99 members in the House of Representatives, each person who represents about 120,000 people in each district. Those are counted on the census every 10 years. We have a census coming up this year. So in 2021, they'll recount and redraw district lines to make it so that each district is about even and how many people that represents obviously depends on how many people are in Ohio, but we have 11.5 million or so people in the state. So that divides into about 120,000 people per district, where House of Representatives are elected every 2 years. They're limited to 8 years in the Ohio House with term limits. So you cannot run in the Ohio, you cannot be elected to the House of Representatives in Ohio for more than 8 years or 4 terms. There are 3 House districts in every Senate district. So there are 33 members in the Ohio Senate, each of them representing about 360,000 people. Their terms are 4 years, and they are also limited to 8 years. Now, sometimes people go back and forth, where they spend 8 years in the House, and they spend 8 years in the Senate, and then they spend 8 years in the House, etc. There are a number of people that do that, but you cannot keep the same seat for more than 8 years. How do you learn about your legislator? We're going to talk about meeting with legislators and what that might look like. But obviously, first you have to figure out who it is. So really, this address works. And you can Google it. Just go Google Ohio legislature, and you'll be brought to this site. You can search by address. So all I have to do is enter your address. And if you do so, the map is a little wonky. I'll admit, it's not the easiest map to use. But if you put an address in here, it'll tell you who's your state rep and who's your senator. Excuse me. And then if you click on that button, you'll get to the representative's page or the senator's page, and they'll give you the contact information. So you can play with it. You can go through, put in different addresses. You can see how the districts are built. They're obviously not all geographically equal because people don't live in a uniform distribution. So some places, some districts have many counties, and some are just a sliver of a county because it's really has a high population density. And a lot of this matters. I would say knowing your representatives matter. Knowing how to reach them matters. And we're going to talk about when you do, how it works, and what you can say to make sure that you are an effective voice to advocate for public health. Thanks, and I'll see you next lecture.